Hello friends, welcome back to my YouTube channel. I am Dr. Vijayan Govinda Gupta, a andrologist and a circumcision specialist in New Delhi, India. I have a lot of videos on the foreskin problems, and today's video is to understand what is phimosis, what is a tight foreskin, and how it can cause problems for you. So this video will be divided into three topics. The first topic will be to understand what is phimosis, what is tight foreskin. Second would be why does phimosis happen, why does a tight foreskin happen. The third would be that why or what problems can phimosis cause for you, and the fourth is what is the treatments that are available for this condition. This is going to be a ready reckoner for phimosis, and in this next 5 minutes we'll be able to understand the entire topic in detail, and you'll be able to understand why you need treatment for your phimosis right now. So phimosis basically means tight foreskin. It occurs in those men who are not circumcised. So basically, if the foreskin should be able to roll back your glans easily in the erect as well as in the flaccid state. If the foreskin is tight and it is not rolling back conveniently, if it is not going back either in the flaccid or in the erect state, then it is called as phimosis. So phimosis is basically a blanket term, and any tight foreskin which does not move back is called as phimosis or a tight foreskin. Now phimosis can be either primary or congenital, or it could be secondary. A primary phimosis basically means that the phimosis or the tight foreskin is present since childhood. The boy always had a tight foreskin and it was not able to roll back. Usually when this condition is detected in the children, the circumcisions are usually done in childhood itself, or some amount of steroid creams or stretching may help. But after the boys hit puberty and after 12 years of age, when they grow rapidly and the penis size increases rapidly, this phimosis may exaggerate, and many of the boys are not able to roll back their foreskin right into adulthood, which can cause problems. This is called as congenital phimosis. The second is called as secondary phimosis, or phimosis that has developed due to a condition. These conditions can be many or several. These conditions can be due to diabetes, which is one of the most common conditions causing melanoprosthitis and tight foreskin. This can be due to infections, which are called as balanitis. This can be due to fungal infections. This can be due to viral infections. This can be due to an autoimmune disease called as Zun's balanitis. It can also occur due to something called as balanitis xerotica obliterans, or BXO, in which the skin gets autoimmune and the skin becomes white and tight. It can also occur in men with herpes and genital warts, in which these warts can lead to shrinkage of skin. It can also occur in those men of primary phimosis in whom, due to continuous traction and due to continuous tearing of the skin, a little bit of phimosis develops into a high grade secondary phimosis. So in whatever the case, if you have developed phimosis, the treatment is required, because phimosis or a tight foreskin can cause several problems. First problem that the phimosis can cause is that it does not allow penile hygiene. The patients are not able to clean their penis, they're not able to retract the foreskin and clean the glans, because of which it leads to accumulation of smegma, urine and other discharges, which lead to itching, infections, balanitis, glans becoming red, a lot of infections. So lack of personal hygiene is one big issue. Second is it can cause major problems in intercourse. It can cause erectile dysfunction, it can cause PME, it can cause pain during sex, it can also lead to poor hygiene. Your girlfriend or your partner may refuse to give you head if you have a phimotic foreskin. You may have intense hypersensitivity, which may lead to difficulty in having intercourse or insertions. So a phimotic patients may have difficulty in their sexual life. Third, sometimes the phimosis can become so severe that the patient may have difficulty in urination. He may have problems in passing urine properly, and this may lead to UTI, especially in elderly gentlemen. This can even lead to retentions. The phimotic foreskin may get stuck behind the forehead, which can lead to paraphimosis, which is again an emergency and an acute, painful medical condition in which the patient may need to be rushed to a hospital. So a phimotic foreskin after the age of 12 years requires treatment, and without treatment the patients may have problems. There have also been reports in which phimotic children who have phimosis, their penile growth is not up to the mark, because the skin does not let the penis to be able to be developed fully. So if you have phimosis, you may see a lot of videos on the internet which talk about using steroid creams, using moisturizers, using lubricants, using stretching techniques, but end of the day, phimosis is a surgical condition. These techniques of stretching, of foreskin rolling, of hypersensitivity reduction, of keeping the foreskin open and exposed to air partially only help those patients who have grade 0 or very mild phimosis or are in their childhood. A fully grown adult man with a fully grown penis who has an erection and who has a phimosis is not going to get cured by any conservative measures. He would require a surgery. The surgical methods can be of three types. It could either be foreskin preserving methods like prepucioplasty, dorsal slit, or a frenuloplasty along with a prepucioplasty. There may be foreskin preserving method like a partial circumcision with ZSR that I normally do in my patients, which helps in retaining some amount of foreskin and also solving the problem completely. A third would be a circumcision, a formal circumcision, which the entire foreskin is removed. Any of the cases, a circumcision, a prepucioplasty, or a dorsal slit is going to solve the problem of phimosis forever and make the patients comfortable and have a convenient urinary, genital, and a sexual life. So if you are suffering from phimosis and you're wishing for good treatment, you can always connect with me on Facebook or on my email. You can get a lot of information on my website, which is the link is given. You can also see a lot of my videos in English and Hindi on phimosis and the various treatment modalities. If you're looking for a circumcision, then ZSR circumcision today is the best method to manage my phimosis, and a ZSR circumcision is exclusively available in New Delhi, India at my clinic. Thank you for listening in. Stay tuned. Subscribe to my channel for more information on such videos. Thank you so much.